Welcome to Wellness Tea Time with Dr. Rita, your go-to podcast for all things mental health and well-being. I am Dr. Rita Sonko, and I am passionate about breaking the silence and the stigma surrounding mental health. In support of the Toli Wekka campaign, this podcast aims to increase awareness about the multi-faceted nature of mental health and normalize conversations that promote understanding and support. Join me as we explore various topics, share real-life stories, and provide practical advice to help you achieve optimal well-being. Let's embark on this journey together because, remember, Toli Wekka, you're not alone.
I feel like we need to get into the gist of the matter that brought us here today, which is the Toli Wekka campaign launch. Today we are looking at how we can break the silence. We are looking at how we can take actions. We are looking at how we can be able to confront the mental health crisis together. So today we are here gathering in this particular room to find a common ground on how different institutions can come together to be able to respond to such challenges. The media fraternity, the entertainment and arts industry, religious institutions, the private sector, government institutions, among other communities. Ladies and gentlemen, I might not be in the very best position to introduce and give you a general overview of what this particular one means. But allow me to take this amazing opportunity together with you by giving a hand of applause to this amazing champion, ladies and gentlemen, that has been able to stand the test of time, but also put their skilled resources to work to be able to champion this crisis. Ladies and gentlemen, let's put our hands together as we welcome Dr. Rita Sonko, the brain behind the Toli Wekka campaign. Ladies and gentlemen, we can do better than that.
Got it. Right. I think I would love to have the panelists come up on stage. Great. I thought colleagues can introduce themselves briefly, a minute, to introduce yourself, which sector you represent, and what you do. Just very briefly. Thank you.
Thank you, Doctor, and much appreciated for this opportunity. Welcome to all the attendants tonight. My name is Muyinda Rama, also known as Baba Ra, and I'm here from the Uganda Musicians Federation Mental Health Department. So currently I'm the sitting chairman, and I bring you greetings from Eddie Kenzo, the president, and Shiba, the vice. Thank you.
Good evening, ladies and gentlemen. Good evening. My name is Rebecca. I work with the Ministry of Education and Sports in the Department of Guidance and Counseling, and I'm an Assistant Education Officer there in charge of Guidance and Counseling.
Good evening to you all. Good evening. Thank you, Dr. Rita, for inviting me to be in this very powerful panel and for this very good cause. I'm Patrick Chamanywa, Vice Chancellor, Uganda Matters University. Please.
Good evening, everybody.
Good evening.
Praise God to those that believe like me. My name is George Timothy, mostly known as Exodus. I'm a faith-based artist and an ambassador for Toli Wekka and a mental health champion. Thank you.
Good evening to all of you. My name is Bishop Michael Chase. I'm the senior pastor of Omega Healing Center, and I am the overseeing bishop of COPE Pentecostal and Evangelical Mission, an organization which brings together believers nationally, and I'm pleased to be part of this panel. God bless you.
Good evening, ladies and gentlemen.
Good evening.
Thank you very much, Dr. Nalongo, Rita Sonko, for inviting us. I'm Noah Malani as a visual practitioner and consultant. I run Nyanza Studio. I create art that those with feelings may be touched. So if my art has not touched you, then you have no feelings.
Good evening, ladies and gentlemen.
Good evening.
And assalamu alaikum to those who can hear that. Just say, peace be with you. I want to congratulate you, Rita, for having come to this far to do this. It's not for the faint-hearted to come in to speak about mental health. My name is Dr. Hafsa Rita Sonko. Assistant Commissioner, Mental Health and Control of Substance Use at the Ministry of Health. Sometimes they call me Mama Mental Health.
Good evening, everybody. God was unfair, gave me the body, but refused to give me the voice. Bear with me. I'm called Ruth Sasire Muguta. I'm Nalongo. I work in the Ministry of Gender, Labour and Social Development in the Department of Culture and Family. I head the family unit specifically on parenting. I'm a parent of 2 children.
Thank you. I think to kickstart our panel and how it's going to work is that I'm going to ask each panelist one or maybe 2 questions. They will answer briefly, and panelists keep it to about 5 minutes, maximum 6, so that we can be able to go through all our questions. And I think I'll start off with Dr. Hafsa, who has the mic, and she's after all Mama Mental Health. We start there with the moms, right? Hafsa Dr. Hafsa is with the Ministry of Health, as she has highlighted. And we know, obviously, this mental health challenge is massive. There must be many, many priorities. Out of those many priorities, which ones would you say are the top priorities for addressing our mental health challenge from a Ministry of Health perspective? Doc?
Thank you very much, Rita, for those questions. And I know many people are like, with all these problems, what are we doing there? What is in there? I just want to let you know that there are some strides that have been made in improving mental health in this country. We've come from very, very far. And there's a lot that is not done. Something is done. And as you all know about Uganda, they're really leading so many things. And I just want to let you know that since 1995, when we first had a mental health, a health sector strategic plan, mental health was one of them. But at that time, there was not so much that we could understand in mental health. Even the definition itself is still a problem even today. People call they refer to mental illness as mental health, saying that person has mental health, as if whoever is saying doesn't have it. Like, we do not even know the difference between the disorders and the mental health. We do not know the signs and symptoms, we don't know anything. And many times we cannot even feel it ourselves, we cannot even identify whatever is happening to us. So that is the journey we have. That's how far we have come. Not even knowing the name, but at least I think now when we talk about mental health, people can appreciate it a little bit. So for the priorities, before there, we have had, as a country, we've had 2 strategic plans. There's one that ended in 2010, and then the other one is ending actually. It ended in 2022, and we are now getting our third one. So there have been so many changes, and I just want to let you know that during the first two, we paid a lot of attention to the clinical care, because that was the biggest problem that the country was actually grappling with. Whereas there was care for malaria, not so well though, but yeah, there was at least some care for malaria, there was some care for measles and everything, people were being vaccinated. But when it came to mental health, there was hardly anything. So we put a lot of our efforts around improving care for people with mental illnesses. And in here you have heard about the renovation. I don't know how many of us have been to Tabika. I don't know. Not that you're sick, not admitted. I'm just saying visiting Tabika. I don't know. Maybe very few people, but it's one of the best institutions in this country, public institutions in this country. So there was a renovation that was done, and it was, elevated to that level. And then we have 14 other regional referral hospitals with mental health units. So that was a big stride, just in the name of improving access. So just to let you know that that has been our number one priority. We are continuing to do that. So we are ensuring that we improve access to mental health care services for people living with mental illnesses. We want to demystify. We want to demystify Butabika. Butabika is not a prison. Butabika is not a dungeon. Butabika is not a punishment to go to. When you're sick, just like you go to hospital for malaria, it's the same we want you to do for mental illnesses. That is our number one priority. Our second priority, of course, in there, the medicines. We are trying to improve the medicines. It's a long journey. Also, I'll not talk so much around there. But we have improved medication for mental illnesses. We no longer have those very old medicines which are making people to sleep all the time. It's much better now. So those are our priorities, improving access to mental health care services. The second priority that we have is not enough having that infrastructure without the human resources there. So we have trained healthcare workers, general healthcare workers, to be able to identify and treat people with mental illnesses. By the way, there are not so many illnesses and they're not so complicated. It's just that we don't know. So we have about 6 common mental disorders, and those are the ones that are disturbing many people. So we have trained people, we have trained the healthcare workers, but we've also trained the specialized people. The psychiatrists are there, the psychologists are there. We have a middle level cadre, those are the psychiatric clinical officers. These people are there to treat and care for people with mental illnesses. So the third is the mobilization. We have mobilized communities to be able to treat and what? To be able to take care. Prevention, care, treatment, and rehabilitation. Most of the people, when they come from the facilities, you do not even want to look at them. You still remember them in the other state when they were very sick. And yet, after treatment, they become better. So that is our third. We want to improve that community care and access, but also the integration of mental health into everything that we do. It's a long story. I think Rita getting me with the time. But let me just add that we are working with quite a number of communities. It's not only that villages as it were, but different communities. The Pentecostals you've had, the musicians you've had, the educationists, and so many others. And then lastly, we want to improve on the research. And I'm calling it evidence-based. We want to offer evidence-based care. We want to we want to give the right data. We want to provide the right data to the communities. But if we have not had any prevalence study, so when you ask me that how many people have depression, I'll tell you that I do not know for certain. But there's something that we are getting out of the health information system. There are some researches that are being done, and so on. And even if you remember, during the census, they were asking you some questions about mental illness. Don't you remember? Did they ask you? Yes, and most of us said we don't know, we didn't have it. And so somehow the data doesn't come out because of a stigmatized issue. But we are continually trying to ensure that we improve on this data that is coming out from mental illnesses. We're talking of a crisis, but we're not sure of the numbers. one, is it a medium one, is it, everyone seems to be suffering, but we do not know the magnitude of this. So we want to improve on all this, and that is where our priorities actually are.
Thank you. Thank you so much, Dr. Hafsa, for elaborating on the issues, on the priorities. I'm thinking, because of the gender mix here, I'm going to keep mixing it up somehow. You started speaking about stigma, and I thought, let's go to Mr. Nwanyazi, who, when he introduced himself, he did not say he has a title Owekitiwa, right? Owekitiwa, because of what he has done in the past, and also the current support he continues to provide to our cultural institutions, right? So, Mr. Nyanzi, can you speak briefly about your thoughts about how cultural leadership and institutions can assist in the issue of stigma? Because there's a lot of cultural issues that we have and traditions that actually stigmatize mental illness. Over.
Thank you very much, Dr. Rotary. I escorted the governor, or district governor, Rotarian, on Mkutu to meet the Katiki. So as we are leaving, I turned to the Katiki and whispered to him that we have this function coming up. Can you give me somebody to work with? And he turned, as fate would have it, the minister in charge of this business was right there, Wekitiwa Kutirunakati Chikomeko. And I linked her to Rita, and we are going to start working together. How can the cultural institution help to stop stigma? The Kabaka is the originator of culture, and also has the power to delete or reform. So he can, for example, declare that you cannot tell anybody to Muguandaru, and the word will stop being used. You use it at your own peril, like being ostracized if you use it. So the cultural institution can do something. And I know when you get together with the and the Nabagirika is very, very interested in dealing with these mental issues, mental health issues. We have had it in Uganda for a long time. I believe in Uganda as well, whereby some people have not been, the only time they would think you actually have mental issues is when you become violent. Until you are violent, they will not take it seriously. But then even when you became violent, instead of taking care of you, they would actually tie you up. So, we have even a saying, Ataina mind tagwadaru. You know what that means? If you do not have strength, don't run mad. Because not be able to beat up people will beat you up. So, yes, my appeal now would be to get to the institution for them to start appreciating and understanding what mental health means. For example, if you do something, the same thing, repeatedly, and you expect different results, then definitely you need medical health attention. If you have been doing it, please, you should check in, go for a checkup. Then there's something else. I personally have experienced something to do with the issues that is beyond your control. There's a time when I had my daughter very sick. Every time they would make a call, they would tell me she had fainted, she had done this. I started looking at the phone and fearing it. Every time the phone would ring, I said, oh my God, they're going to tell me come and pick her up. Then, as if that was not enough, then I had a son who was having problems at school. So how do you handle that? How did I handle it? This is what I did. I resolved resorted to prayer. And the moment I would pray and hand over to God, I'd go to sleep. The other time I got depressed and almost running mad was during the, believe it or not, coronation, because I was in charge of security, and the royal wedding. Because taking care of the Kabaka was one thing, but the royal wedding, you had the Kabaka, you had the president, you had the Mugole, the Navajo. And for the first time after about 50 years. So what did I do? I resorted to prayer. Back to cultural institutions. We need now to start looking at how do you describe omuntu alina ekizibu naye ng'atya okukyogera kubanga ajja kuswala. Totya kuswala, toli wekka. Singa abakulembeze baffe boogera ku bati oba teweewulira bulungi yogera. Naye ate bamanyi okwewaliza ati nze ndi mutafuwa mutu nze temunzenze. Declaring yourself insane. Mvwako. This is no joke. So I would like to request the cultural institutions to creatively start addressing that issue. I know they're going to do it. I've just had an interview with the BBS. You're recording something, and I told them about these mental health issues. Everybody I've talked to is interested in the institution. So I believe something's going to be done. And may God protect us from people who create policies that create mental health issues.
Thank you so much, Mr. Luna. I think let's go next to Bishop and carry on the conversation around the role of the faith leaders. I think you have a very important role to play. Would you agree, Bishop? What can you say about what you can do as faith leaders to help the congregation and the community at large to understand mental health and their support?
Thank you, Dr. Rita, for the opportunity to share a few thoughts about our religious approach to mental health challenges. My heart is full of so many things I would share, but let me first of all let me talk under two P's. One P is perspective. I've been a minister in the church for the last 40 years, and I would like to say that in the last 40 years, I would acknowledge that there's been a big deterioration of mental health in Uganda. I started preaching when I was 19. I'm now 63. And I've been sitting in office and watch people come to me, and they have been having so many different challenges. One thing I realized, because as theologians, we do psychology, we do counseling, we study this, but I realized with time that there has been a bit of neglecting of religious leaders and their role to mental health. Our change in perspective to date, I attribute it and I give thanks to the Ministry of Health, who have opened the door that we may be partners in this mental health struggle. And we want to change the perspective. We believe that churches are the biggest mental health centers. Churches, mosques, because people come to us willingly every week. And the challenges we are listening to, we need a close-by partner, Toli Wekka. We need someone professional to work with us, to walk our people through the mental challenges they are going through. And like a swimming pool, there's a shallow end and a deep end. And we can help our people navigate through shallow end emotional challenges. But there's a deep end of it when we feel we need to hold to some people who are professional to help us make things better. So we come out as religious leaders, even now, in a more affirmative way, saying we do not want to be left out, and we want to work with all of you with this challenge of making our people better. I would have rambled on that area, but I see that we need to change the attitude of saying that is a mental issue, this is a spiritual issue, and this is just a physical issue. We believe that something touching your body will definitely reach your soul, will definitely reach your spirit. And as is properly said, Doctor, at the beginning, the trichotomy of man, body, spirit, and soul must be considered, and we are out as religious leaders to be guided on how to do it better, and also to seek you people to concede that we have been doing a good job, and we need you to come and also consider us as team. That is perspective. Strategy, I believe the statistics are mind-baffling when you read, well, they are not official statistics, but what we see in the media, they say over 20% the population of Uganda needs mental health support. And 20% would give you something like 14 million Ugandans. And I was talking to a mental practitioner, a psychologist, and she said, our clinics are empty. And that's ironic. If the clinic is empty, and yet the city is full of people who are having mental challenges, then where are they? I believe pretty much of them are already in charge, but we do not know what to do with them. So working together, partnering together is the way forward. So I really agree that this is timely, and I think Toli Wekka is on time. God bless you.
Thank you. Thank you so much, Bishop. I think up next, let's talk to Miss Rita here. I want my mic, so it's fine. We'll use this mic. I want to talk about, ask you a question around child protection and parenting. Your Ministry of Gender, Labor and Social Development is in charge of these areas. How can we integrate better mental health support and understanding within these programs, your parenting support programs and your child protection programs? Because a lot of the mental health issues emerge from the home, right? Your thoughts?
Thank you very much, and thank you for appreciating the social development part of it. Because most people, if you talk about mental health, they usually think Ministry of Health. And this is very good, and we appreciate to continue working together. Child protection is one of the issues that is not for one person, because mostly there are issues that help the child on how he can benefit and grow and fulfill his or her potential. And one of it is also parenting. And child protection interventions do not only start with the child, and which mostly Ugandans we are implementing, but the child entirely depends on the parents, and the mental health of a child depends entirely on the parental mental health situation. Most of us, we are aware that parenting is not a joke. It is a duty and it is a role. As you heard from Mr. Nyaweti, there is no parent who can be happy when the child is not happy. The same way, there is no way a child can be happy when the parent is not happy. And so most of our children have not enjoyed their life because of the situation happening within the family and especially between the parents. Most of us have lived in violent homes where both parents are always quarreling, have challenges. It affects the children, and it has been seen that one of the things that pushes children to go into early marriages is one of the family violent families. We have seen that the mental health of children, before you address it, you need to address the mental health of parents. A stable home has a stable community and it has a stable nation. When we talk that we are having high incidences of mental ill health in Uganda, it means even our families are not stable. Check within your families those who are here. What do parents pray? What role do they play? What interventions will they help in order to make sure that we reduce mental ill health challenges? One of the things we need to know, that prevention is better than the cure. Most of what others have talked, they do it when the issue has happened, but parenting does it before the issue has happened. So as our role as Ministry of Gender, we have to make sure that we create awareness, and we are not doing it alone. We are doing it with Ministry of Health, Ministry of Education, and others. How do we work? Ministry of Health and Ministry of Education go through the ministries, through our community workers, to reach the home. If the mother is pregnant, she has challenges. And if we don't work together with the father and the mother, the child will come up with some challenges. And that's how the mental ill health starts. One of the another challenges about people, we are saying poverty, and we become absent parents. Most of our children are parenting themselves. If not, they are viewing other people other than learning from you. And so with this, the children wonder whether they have parents who love them or they have people who are just providing for them. Take an example where children come back from school. The first question is, where is your report? How have you performed? What would be the best question for the child? How was school? How were you? The education is secondary. But if that child fell sick at school, you wouldn't even ask that. You would go back there. So let's know how to provide love and protection for our children, and that is child protection. Ensure that in the provision we are not seeing the things that we are providing as economy, but we see them as our role and the privilege for these children. Take an example where you live in Kampala, especially most of us we are in Kampala, where you find at this time children at around Fairway, they are where selling things. That child will never be in a happy situation or in a health situation. Because what you think as a mother, as a father, when you are outside there, now this child of 10 years, 15, is seeking ahead of you. And that means that is a distraction. That's why most of our children have got effects. And some of these effects is that they no longer love, they are violent, they don't think about others, they think about themselves, and they are always easily depressed. When we talk about the challenges we are seeing now, children hanging themselves, it's because we are not there in the lives of our children as they grow up. And that is, we demand a lot and we don't provide anything. We have more conflicts and we prefer conflicts among ourselves and show them to the children. Some of us grew up without knowing our parents fight, but today we are fighting when the children are seeing us. And the child who is exposed to conflicts has a poor mental health. And all this, if the child comes from home with that situation, reaches at school, the teacher also has his or her challenges, puts again the same stress on the same child. What do you expect the child to be? As I talk now, Dr. didn't bring out to you that in Utabika, we have a ward for children just who are in drugs, who are mentally sick, not because they would be, but because of the family issues. Parents, we need to change how we are parenting. If you cannot parent children, don't have the children. I usually explain to people and they think I'm not good. But I'm good because instead of bringing a challenge to the community and to bring a child who will not enjoy, it's better you don't have that child. So as a government, Ministry of Gender, we've come up with the general parenting practices that we are sensitizing communities. There are 13 of them that can help parents to be able, and one of it, have time for your child. What do you talk about your child? How do you discuss with them? How do you talk to them? Do you see them as friends or you are seeing them as children? And that one will not help. We have even involved in the National Parenting Training Manual that the parent can go through 14 modules and be able to be a better parent. We are struggling to come up with a family strengthening policy where we are getting everyone not in for it because they think we are going to interfere in their lives. But unless the government comes up with such, in which the people of mental ill health, of vaccination, of child protection has a focus on the family to help this parent, even who accidentally becomes a parent, to be able to love this child, then we are working for them. But together, if these parents, you are through challenges, especially parents with adolescents, where adolescents want to question, to show, to find out, and you are challenged, you are not alone. Toli Wekka, there are others who are there and who have gone through these challenges of adolescence whom you can talk to. If you can't, go to your religious leader. If you can't, go to the medical people. But talk. When you talk, you release. Instead of even creating more challenges to yourself, because if you are not mentally well, then you cannot help the child. We hope if we work together, we will break the silence.
Spoken very, very well on the issue. And I think that brings us, I'm not going to go to a gentleman, because I think that the nicer follow-on of this is education. My sister, the teachers, what is the role of teachers? And the support staff. I think sometimes we only think about the teachers, but in Uganda, where we have a lot of children in boarding schools, those boarding mothers or matrons, the people who keep them in the dormitories, the people who cook the food, there's so many people in the school setting. What is their role in promoting mental well-being of our children? And they're spending a lot of hours at school. And how can we support them do a better job? Thank you.
Thank you, Dr. Rita. Actually, before we think about what these people can do, we also need to support them. Like, you cannot give what you don't have. Teachers are also challenged. The school staff is also challenged. We've seen cases where it's the teacher abusing the learner, leading to mental health. The head teacher abusing the staff, and then the staff displaced to the learner. So, as means of education, what we are looking at is looking at the entire school community. What can we do? Starting from the administrators, we come to the staff, and then the learners. Going to what you have asked, what is the role of the school staff and the teachers? First of all, these are the people with our children, with the students. Yeah, they are the first people to notice that such and such a child has a problem. Such and such a learner has a problem. And the teacher can easily notice, for example, a teacher in class can easily notice, this girl used to be active in class. This boy was very active. What is happening? Why is he withdrawn? So their role, first of all, is to identify. They must be able to identify. But we have to build their capacity so that they are also able to identify. Because if you don't build their capacity, they also have issues. The teacher, for example, has spent some months without salary. Their children at home. They themselves are thrown out of the houses. When they come to class, of course, they cannot identify a child who has issues. So their role number one should be to identify a child with an issue and then intervene immediately. But not forgetting that they also need support. So we as Ministry of Education are presently developing guidelines on how to provide mental health in schools. Actually, the whole of this week we've been in Ginger, developing material, readers for primary and secondary school learners to create awareness first of all, so that they can know. Like doctor was saying, in Uganda when they talk about mental health, it means mularu. Mularu, actually they call it mental or your mental. Yavako, yasimuka, wayatalina, to create awareness and to know that like anyone can have a challenge of physical health, mental health is also, no one is immune to mental health. Even us, Rebecca may be here when she's mentally challenged and you are not even aware. Another role for the teachers and the school staff is creating a supportive environment, that conducive environment, psychological environment, emotional environment. As staff, let me know, so all the teachers, the staff, be it a SCARI, the warden, the matron, they should be able to create that conducive environment for the learner to be mentally okay. If it is the cook saying, that alone can make this child uncomfortable. There is another competent suicide because the teacher was saying she was too old for the class. Like she was ready to get married. What are you doing here? You should go out and get married. So that environment, live around the infrastructure and what have you. I'm talking about that psychological environment, the emotional trauma will cause to these learners affect their mental health. So they should be able to create that supportive environment. And also to be friendly and welcoming. I mean, when a child has an issue, he or she should be able to come to the teacher, to the warden, to the matron and share their problems. One of the reasons why mental health is, like the doctor was saying, stigmatization. Like when I share, they will say, they will say that I'm not okay. But if you are friendly and receptive, these learners will come to you. So we are saying the staff, I don't know to teachers, the staff should create that environment where the learners can easily access it and get support. Another thing is provision of direct support, like providing counseling and of course guidance, counseling, not the technical one, but to be able to provide the necessary support required, and also promoting mental health awareness. How is it integrated in our curriculum, for example? When you are in class, how do you integrate that? When you are doing these other sessions, we have chaplains in schools who help our learners. How can they integrate these issues of mental health? Yes. So with the school staff, there is a lot they can do. Even on the teachers, there is a lot that they can do. Not forgetting that they also need support because they cannot give what they don't have. We've had cases where teachers themselves abandoning themselves, killing themselves. So now such a teacher cannot help the child. They also need help because they go through a lot. They also need the support. And like our thing is Toli Wekka. Teachers, they are not alone. Learners are not alone. The head teachers are not alone. There is a certain teacher who also committed suicide, and you expect this person to help. But he also has challenges.
Thank you. Thank you so much. Very well elaborated. I think let's go to Prof. Chairman next. Prof, you representing training institutions. And I think it's a very nice, segue to the point I want to ask you from what Rebecca has discussed. We're dealing with mental health, but we have to train people appropriately so they know what to do. So there is obviously the health workers, the health professionals who need to know what to do. But now I'm thinking the teachers too, right? Like Rebecca was saying, they also need to know what to do. How can training institutions incorporate mental health education better in the programs that they run?
Yeah, thank you, Dr. Rita. That's a very complicated question. But I will try to dissect the elements that I think are pertinent to our discussion tonight. Yeah, looking at training institutions, of course, we are also culprits in perpetuating mental ill health because of what we take the students through. Everyone here has probably had a mental challenge through school or university. And this stems right from the simple stress of a paper to the disappointment when you get a retake, or even having your friend being discontinued, in addition to your personal stuff that you carry with you from the social aspects. So yes, there is that element. But of course, what we need to do today, and I think it's something we need to be factoring into our curriculum, is the training beyond just the mathematics, science, geography, and stuff. Our curricula have not had sessions for stress management. They have not had sessions for how to resolve conflicts. That is not there because we consider that other things. We call them other things. But these are the soft skills, the real things that matter now if mental health is to be tackled effectively. And how do you handle, or how do you even avoid burnout? You know, because when you look at the university environment or the school, the general learning environment, the lecturers or the teachers, or like Rebecca was calling them, or the staff, actually are also suffering from burnout. They are suffering from stress. They are having their social stresses, but also have the job element stress. And they are expected to prepare the learners to cope. But they themselves are failing to cope. So it becomes difficult. So what does that mean? That in addition to providing sessions for stress management, conflict management, psychosocial support and counseling to the students, it also has to be done for the staff. So the human resources department has to come in here at the university to provide counseling or to provide a safe space where people can disclose. One of our biggest problems, not only in the learning institutions, but I guess in the entire society here, we are not used to disclosing our ill health. And that is why even for other medical conditions, often, if it does not cause you to be physically unwell and visibly so, you will not disclose it. You know? Come October, we shall be talking about breast cancer. Breast cancer, cervical cancer, prostate cancer, and what have you. People first actually appear physically ill, then they say, but then but we are not used to disclosing. And that is why I think the mental health challenge is still quite a huge one, because we are not taught to demonstrate our vulnerabilities in a safe space. So in the learning environment, I think that's what we also have to emphasize, to provide safe spaces, provide peer and other institutional counseling services. Taking an example of Uganda Matters, it was only last semester when we formed a peer counseling group to be able to help us curb what we were starting to observe, that people were dropping out not because their parents didn't pay, but they just said it's enough. They are overwhelmed. And I think there is need to do some research also locally. I was reading earlier, and last year there was a very interesting study conducted in the US among 90,000 students in over 130 campuses, university and college. More than 60% of them disclose at least one element of mental ill health. 60% is huge. It's huge. And of these, about 44% actually had all the criteria for diagnosis of depression. 44%. This is a big problem. But like Dr. Hapsa was saying, we've not done research locally here. Probably this is something I'm going to take on with my colleagues. What is the prevalence of mental ill health in the universities? We don't know. In the schools, we don't know. But looking at the curricula, yes, we've got to do that. And this has to come actually right from primary or even early. Because like Bishop said, and I think the gender lady, the parents are absent, so the teachers are actually doing the parenting. Because 3/4 of the year, the children are with the teachers. It's only 3 months of the year that the children are home with their parents. And the parents don't have the patience for their children. And we saw this in the COVID lockdown. They were saying, when are these children leaving us to go back? They became a burden. So which means we really need to strengthen and improve the capacity in the learning institutions to train these children. One, how do you handle delayed gratification? Because the parents, not to have any problem with the student or the child, they will give whatever the child wants, just not because they love them, but to get them off their back. Now, at the university, we don't do that. If you've gotten a 49, I won't give you 50. I will give you a written. And you don't know how to handle that. You know, the children don't know how to handle that. So these are the things we need to put in the curriculum, things that will build mental resilience, to be able to withstand disappointment, to cope with disappointment, and delayed gratification, failure, and stuff like that. Coming to medical school, yes, we train doctors. I am a doctor, a medical doctor, I am a surgeon. I see many of my colleagues in the audience and Dr. Rita as well as our host. We are taught to treat, diagnose and treat psychiatric illness. But then, we are not taught how to care for ourselves. So who takes care of the care? You know, because the doctors are actually burnt out as well. As a medical student clerking, you are so worried about so many things. But you have to clerk this patient who has come in with suicidal ideation, with depression and all that. But that also has an impact on you as a student or even as a medical doctor. But then you don't have where to go. And that's why we are seeing today a challenge among especially younger doctors, but also a few of the older doctors, of burnout, drug abuse, and stuff like that, which should now point to something in the training that needs to be addressed. And I think the same things I've talked about, stress management, conflict resolution, have to be incorporated into the curriculum early enough, even before the psychiatry rotation comes in. Because even just clerking on the pediatric ward, those of you who have been to hospital in the children's wards, you know how serious the kids come in when they can't breathe and everyone is fighting for the oxygen tube. And they start dropping off one after the other, and they are replaced. the bench is always full, and when you drop off, they just replace you with another who was waiting. That is very traumatizing to the doctor, to the health worker. But how do we care for them? So those are the elements that I see as training institutions we need to take care of. The trainers and the trainees both need that care, and I think we need to provide that support, but also the awareness and preparation on what to anticipate and how to cope when that happens. Thank you very much.
Thank you so much for detailed issues. I'd like to now bring in our musicians, and I'll start off with Mr. Rita. If you could please talk about, musicians, you guys have a huge influence on our population. Everybody, I forget what your stage name is, you're going to tell me just now. But, we sing your praises, we follow you on social media, we're watching you all the time. That means you're role models. What can you do to influence better attitudes and help us on this journey of increasing awareness of mental health? What can you do as musicians? How can you influence? How can you leverage your big influence that you have?
Thank you so much, Dr. Sonko. Once again, my name is Muyinda Rama, and the stage name is Baba Ra.
Baba Ra.
Yeah. So I come from UNMF, Uganda National Musicians Federation Mental Health Department, and just to use my time properly, let me start like this. Did we all hear something that was making noise? And when you hear it, what comes to your mind? Are we safe? So that is the what? Toli Wekka. It's actually an alarm and an awareness shout out to all of us. That's how we should hold it. We have all talked about stigma, and we cannot avoid it. And we know that artists or creatives are 3 times more vulnerable than any other normal person. This is because we are always in the public eye. You have a demand for the next hit. You're living a life that is fake. People think you actually are up there, yet you saw this in COVID. And it brings you so close into what we call self-destruction. What happens to the artist mostly is self-destruction. He just says, let me go and smoke my weed, let me do this. And when I come on stage, people will think everything is fine with me. So we have done a bit of research. Of course, mental health is still young in the country, but we started up this department based on what was happening to our fellow creatives. There is a very, very big number of creatives out there that are suffering, that are really not doing well, and even those that are established, not established, yet to come. So, secondly, we started up the department to ensure that we reduce on the levels of discrimination and also isolation, because this is what happens usually. When we received the call about this in the committee, it's a Friday, so many artists are out there on shows and what. But everyone had this attitude of, and then I was like, but actually this is something very big, we cannot afford to miss, and we had to make sure that we send a representative to come here. So mindset is a very, very key issue, and I want to just re-echo what OHT Nyaz was mentioning about policymakers. I think we all remember what happened at Kololo when the traders were meeting His Excellency. People just walked away. You cannot bring IFRIS on an industry that is not sensitized. You cannot speak, let me speak for the artists. We have been fighting for copyright so much, but you will see that they are also taxing us. So what will happen to the population? Guys are going to get crazy in their own ways and at different levels. So speaking of poverty, unemployment, Toli Wekka is something that should come to mitigate all these challenges. And now what can we do as artists? What we need first of all is to realize that we are actually not professionals. Yes, we are suffering the problem, it is there, but we are not professionals, we are not counselors, we are not psychiatrists or something. So what we did first was to create a platform for professionals to come and address some of the issues we are facing as a sector. So because we are actually icons, or people celebrate musicians so much and creatives, we know that we are so impactful on the public, and we are taking this as one of the key priorities that we have to work on in our next 5 years work plan. And as UNMF, we have what they call a jam session every Tuesday, where we celebrate artists that have been out of the game for long, or even invite other important people to come and speak to creatives, professionals especially. I would like also to recognize Dr. Hafswadia, who has supported us so much. When we knocked on the doors of Ministry of Health, she was so welcoming, and we have moved a journey, and we thank you. We want to move with you again and again and again. So we have a platform for professionals to come and practice or deliver the services, and then we have created what Professor was saying here, the safe spaces, because there is nowhere you will tell someone to go and report themselves that it is hard. It is hard. So we created that place where you will see Jackie Chan coming to speak, and then tomorrow Ophelia will say, let me come, and then, we are even mentioning these names because the artists now are proud of it. They are like, this is actually helping us, and I didn't know I had a problem, but I actually do. So seeking for help is not a sign of weakness, but actually a sign of strength. We are also creating collaborative activities with different partners, and I think if you're into mental health or an initiative out there, you know that on the 11th we have a sports gala. Ensure to turn up. If you don't know about it, you can seek information from here. There are also outdoor wellness activities that we are working on. Now, I will not say what can we do, because this is new, and I'm just presenting what we have in plan. So, mental health workshops, music therapy, that one I've spoken about it. And then I also wanted to mention something about debunking the myth, because there are so many myths around mental health. Bakuloga, yewamwe, what, all those things. And usually you don't find better solutions if you keep in that same line. And if there is no one to talk about it, because we all know many people didn't want to talk about this topic. But I want to thank everyone. My fellow panelists who are here. This is just the beginning. And just before I make my maybe last remark, there is something that happened to this country. We have democracy, but people actually call it freedom. So I think it happened in the right place, but at the wrong time. Either right place, right time, wrong people. I just don't understand. But there is too much freedom that people have started abusing it. And this all comes back to accelerate the dangers of mental illness. Actually, when we say mental health, most of us thought that is the sickness. Until we were with Dr. Swan, she was like, no, mental health is, everyone has mental health. We are all mentally. It's our health of the brains, but it's the illness. So there are so many illnesses that come around that. But what I wanted to say about freedom, and this one I may pose it to the entire panelists here, that how can we draw a line between freedom and national values or national and cultural values? I don't think we have a national policy here, a national values policy in the country or something, but there is something that has to be done. Where does the person know that now I am free to sing anything, or tomorrow I'm free to sing EKUND, that song that is trending. I cannot even push it in my mouth now. So there is a lot that we need to work on. But as artists, yes, it is true. We have too much influence. You have seen so many young people following artists' way of walking, artists' dress codes, artists' what. So we are trying to change the entire narrative and to show that we are actually better people. We can actually spread out a bigger message. So we should all be mindful that 1 in 4 people are at risk of mental illness, and World Health Organization just released a report that says 350 million of us in the world are very, very sick. Time is now to take action. No need for politics, no age, no religion, no what. We need to work as a collective. All illnesses begin from the mind. I came here and when I was introducing myself, I said I'm the sitting chairperson, but our chairperson and founder of the department is Miss Nachisige Shabim, also known as Nakis, who has been struggling with a heart problem. She has undergone 3 surgeries, and because of this, because she started getting these surgeries at about 14, she actually lost her normal senses. So people don't know how to handle her. If you don't know she's sick, you may think she's actually not, she's not saying the right thing, or she's insane or something. But she has a lot of passion, she has done a lot. We still seek your prayers because she has to go for surgery in the States. Her last surgery, hopefully, she comes out properly. But there are many people with underlying diseases that have ended up having mental problems. So, Toli Wekka, I believe, let us move together. There is a lot we can do to secure the future of our country. Thank you.
Thank you. Thank you so much for that. Panel discussion. I would like to ask my brother, George. George, your story is powerful, and when we met a few months ago, we did a podcast, and the audience and anyone here can actually go and listen to that podcast on Spotify. Wellness to Time with Dr. Rita, the full story is there. But I wanted to ask you, many of the things that have been touched on, from childhood, child protection issues, from your career, in fact, but even prior to your career, life on the streets as a street child, and then coming out, getting into the church. So all the panelists here actually touch on your life. And I wanted to hear your reflections. What are your, in brief, your reflections, having come out with your story and inspired so many people? What do you think can be done to encourage more people to come out and share their stories, because our stories are powerful and they encourage others?
Thank you, Dr. Rita, my sister. Thank you so very much. And I want to thank God for all the panelists here. They are great people in society. And I think with them, Uganda has a future to see that mental health is a situation that we need to deal with like immediately, like yesterday. I love the Bible because from childhood, God and hope is what has kept me through life. First of all, we all need God. Whether we like it or not, we all need God. Because without God, you struggle so much. But if you are inclined to godliness, there is a hope, first of all, that everything is going to be well. Everything is going to be okay. Allow me to read 1 Corinthians 13. It says, if I speak in tongues of men and of angels, but do not have love, I am only a resounding gong and a clanging cymbal. The South Africans call it Ubuntu. I think we need to get back to a place where we value humanity. We have lost that. Even in religious settings, I thank God that Pastor Chazé is right here with us. Even in religious settings, we have lost what we call humanity. And I think it is the biggest reason why people decide to call back. Because we all know, if I speak to my neighbor, I will hear it all over the community. And it's a very, very big problem. We need to get back to a place where we are our brothers and our sisters' keepers. If we are really going to deal with this issue, because it begins from rejection. First of all, in every state, it begins with rejection. And then it crops to all the other different things. When I fell into my situation, the people that I held up so high in esteem and I thought would stand with me, even to make calls to people that had cast me out of what was mine, rejected me. And this is a very big religious leader. They rejected me. That alone just sunk me deeper to a place where I thought, oh, as I was on the street, I am now. I am alone. So let me deal with my frustrations alone. Before I knew it, I was back on drugs. Because before, it is drugs that kept me sane. Now I am back on drugs to stay sane, to keep my mind away from disappointment. It is very important because my brother from Barbara has spoken it all. I'm not going to go back there. But I just want to urge us to get back to a place where we are our brothers and sisters keepers. We have lost that as a country, as the whole globe. You look at corruption in the country, it begins where people just don't care about anybody. We only care about us. You know? To the point it even creeps to churches, where instead of sticking to preaching the word of God to change the people, we are preaching money. I am a son of the church. You understand? We are preaching how we can collect more money from people instead of how we can show people God and help them out of the situations that they're dealing with. There is great lack of employment in our nation because there's a few jobs for few people. So, if we do not get back to a place where we are all our brothers and sisters keepers, we are headed to a place where we are all going to be mentally healed. Where you know? So we need to get back to Ubuntu and remind people, you're not alone. Toli Wekka. It is okay to have issues. We need to let people understand that it is okay to have problems. It is okay to have challenges. But when you have them, feel free to come and talk to me. Feel free to come and share. Feel free to go to anybody to share. It gets down back to Ubuntu, humanity. Toli Wekka, break the silence, break the stigma.
Thank you. Thank you so much for that. I think that concludes very well our panel. I don't know if there is any burning questions. I know that we have used more time than we had anticipated, but maybe we can allow maybe 2-3 questions from the audience. We may not be able to see you, so we may need some lighting. Just to be able to take a few questions for the panel. We will allow 3 questions if there are any questions in the panel, in the audience. And then we will respond to those and we will wrap up this session and I'll hand over back to my MC. Any questions?
Any questions in the audience? Yes.
Mental health is such a big issue and we all grapple with mental health. But
Toli Wekka is what I want to understand. What is Toli Wekka? Is it a platform? Is it an institution? Is it a place we can call? Or am I preempting the conversation ahead?
Great question.
Mine is a message of appreciation. Thank you very much for everything, for whoever said that word. It's been very important. Mine is a request. Is it possible to organize talks to different schools? I'm a teacher and have so many challenges in schools. If we could organize such and come to schools and talk to students, it would be very, very wonderful. Thank you very much.
Because especially in schools, certain students fear to go to the counselors because they discuss students' problems with like everyone else in the staff room. So how are students supposed to get help when the teachers that are supposed to help them are not helping them? Thank you.
Okay, so we have 4 questions. Let me start off with Toli Wekka. Toli Wekka is a campaign that is aiming to from all sectors. So with Toli Wekka, we're aiming to create a mechanism to mobilize different sectors, not only those that are represented here, but all of us that are in the room. Private sector, for example, communities, community leadership. There's so many people that can come on board to help and create mobilization and a wide-scale public health approach. You know, these days when you talk about public health, I think the general public is aware because of the COVID pandemic. We were all in lockdown, everybody was mobilized, everybody knew what it was. We can do that for mental health. I don't think there's anyone in the world that you can ask, do you know COVID? Do you know about, lockdown that happened and why it happened? We need that level of mobilization, and it will take everybody to be on board. So all institutions, all different sectors to come on board. And for us as Toli Wekka, we are really more of the mobilizers of that. And the mechanism through which everything will happen, that is taking shape as we engage with the different sectors and as we are led by our ministries of health, of gender, of education, and even others that are not here to figure out how do we do this on a large scale. Thank you very much. I think let's have Dr. Hafsa talk about that definition of mental health, and then there were a couple of questions for education.
Thank you very much, Dr. Rita. But I think according to our program, there's someone who's going to give us a keynote address, and that is something that we're really prepared to explain and get into a little detail and put it into the context of what we all can, me and you can understand. So let me not preempt my discussion. I just rest my case. But what I want to say is that we need to think about mental health in everything that we do. It is part of us. It's part of everything that we do.
Yes, thanks. There was a question about teachers and disclosure, and then finding your story is in the entire staff room of the school. Yeah, happens. But I think it's because we've not yet done enough of training. Because borrowing a leaf from medicine, which I know should also have relevance in education, in teacher training, is the professional ethics. That what you are told, and that is confidentiality, what you are told remains a contract between you and the client. Now, many teachers have not had that kind of training, and I think that's where we need to probably start from. And I know that the Ministry of Education is doing something about it, and so I will ask my sister Rebecca to continue on that. But just to say that we need to be bound by the professional ethics, and someone needs to be held accountable. At the moment, that structure is not yet well spread, and that's why you find people fear because they know, and like George here said, you tell one person and the entire village knows you're having this problem. And that further strengthens the stigma which we would like to fight. Rebecca, I think you have something.
Thank you very much for bringing up that. What we advocate for in schools, and we've been advocating for this for a long time, for the schools to have full-time counselors who are non-teachers. Because this work can be so overwhelming, and when the teacher adds this task to teaching, they cannot manage. But what we are doing, for example, this quarter we are in, we are planning to train teachers in charge of guidance and counseling in schools, because they do not have full-time counselors, to train them to build their capacity, to have these basic skills, at least to handle such cases of learners. In our structure, we have senior men and senior women teachers. We all had this during our school time, but we also found out that learners do not confide in these people because they tend to be tough. So we want to get someone we call a guidance and counseling teacher if we do not have a school counselor to help us handle this. I agree with you. When we go out to train these teachers to build their capacity, we told them they should keep your secrets. Confidentiality matters a lot when it comes to this. When a child comes to you and tells you, you see, my father is accusing me, you do not have to go to the scaffold to let your colleagues know that the child is being abused. We try, but you know, it will take some time. Another colleague said that these talks should go out in schools. Yes, we are trying. Actually, the Ministry of Education came up with a circular we call Circular 20 to all educational institutions, directing all educational institutions to make sure that mental health is supported in schools. 1 hour designated weekly for mental health, and to allocate 1% of their budget towards mental health. Like to take the circular action, I have your copy here. Only that people do not comply with the directives the ministry gives. It's like the circular you have on corporal punishments, but schools still beat. But it is illegal action and punishable. So we are moving around trying to disseminate this circular to let the schools know the importance of mental health, and also to put up structures in place to support mental health. That's why we're developing now materials, guidelines on how mental health can be supported in schools. Readers for learners, like we had the PSA to fight HIV/AIDS and these other things. Now we are coming up with the readers for primary, for secondary, and maybe later for tertiary institutions, for learners to be aware about mental health, and the staff to be aware, to have these basic skills on how to keep their mental health healthy, if it exists. Thank you. But it's not like we are doing nothing, my dear. We are moving around schools. Actually, last week I was in the field in Ruwero. I'm still about mental health because psychosocial support. And it is worse actually in private schools, because there was a school I went to mention, they were like, the boy committed suicide because the colleagues were calling him up. They were like, that in class and said, how many boys do we have here? And they said, 3.5. So that one boy was a half, eh? Because he was called a half, the boy, when he went home, like, he was short and tiny compared to others. And on top of that, the father didn't buy a phone for a smartphone he needed. The boy committed suicide. So at times, even bullying, you know, there are very many causes of mental illness. Even bullying in schools, home, like my colleague from gender said, the community itself, the people who are supposed to protect us, they are the perpetrators, they are the abusers. The father is abusing, the brother, the uncle, at times the mom, so a lot has to be done. And with mental health, like we said, it is Toli Wekka, it's not a one-person initiative. It must be like everyone, it starts with you, you have to work with everyone in the community to see that we fight this. Thank you.
Thank you so much. Thank you so much for that. One thing, quickly, and then we'll wrap up.
Thank you very much. As we do all these things in health and in education, I want us to remember this. that everything begins at home. And one of the studies have been shown that children who experience poor parenting from 0 to 3 years are more likely to be depressed, to have anxiety. You know, children who have anxiety, they are likely to be depressed also, to smoke, chain smokers, abuse drugs, and involve themselves in high-risk sexual behaviors. So as we fight this, let's ensure that our responsibility is the parent. One of the things when you hear children who are having such challenges of killing themselves at work is the low self-esteem. And the esteem is being instilled by parents. Let's ensure that we build the confidence of our children, build their self-esteem. Whatever, if your parent tells you this is what it is. I give myself as an example. I grew up as a fat child. I don't know what it means by being small. But my mother told me, you are the beautiful girl. No one, God saw that if you be small, you will not be beautiful, and no one should look upon you. So whenever people would say, yeah, she's big, I would say, I'm the most beautiful, and I know even up to this time, I'm beautiful. So the confidence you put in your child helps even when the bullying comes, I know how to cope with the situation. But the way we have brought up our children, baby, mama, like this, they cannot face the challenges when they reach somewhere. And so when they are faced with the challenge, the only solution is killing themselves. God bless you.
Thank you. Thank you, panelists. It's been a great discussion. I believe we've captured it and we'll document it and share it extensively because we've learned a lot. And I hope the audience also agrees with me that it's been fantastic.
Thank you for tuning in to Wellness Tea Time with Dr. Rita. I hope today's episode provided you with valuable insights and encouragement on your mental health journey. As we support the Toli Wekka campaign, let's continue to raise awareness and combat stigma by having open, honest conversations about mental health. Remember, you're not alone in this journey. If you found this episode helpful, please share it with others and subscribe for more inspiring and informative content. Until next time, take care and prioritize your mental well-being. Together, we can make a difference.